Diabetes is a condition where your sugar levels are higher than normal. There are two types of this condition, type 1 and type 2. In most of the cases, type 1 occurs before you reach the age of 25 and it accounts for 5% of all diabetes cases. Here the pancreas stops producing insulin, which is the one that lowers the sugar levels in the body. For you to continue living, you have to keep on injecting yourself insulin. Type 2 diabetes, on the other hand, develops after you reach 40 years. It comes about when the pancreas stops producing insulin or the body cells become resistant to insulin. Both types of diabetes result to high sugar levels in the body. When the sugar levels are too high, the blood becomes sticky. The sticky blood tends to block the blood vessels, bringing about a number of complications such as poor wound healing, cardiovascular diseases, eye, leg, nervous system, and sexual organ problems. How to control the condition? There are many ways in which you can control the condition. One of the ways of doing it is learning as much as possible about the condition. The cool thing is that there is plenty of information online where you can get almost any information you need to know.
After about age 20, we may have all of the insulin-producing beta cells we're ever going to have in our pancreas, and so if we lose them, we may lose them for good. Autopsy studies show that by the time type 2 diabetes is diagnosed, we may have already killed off half of our beta cells. You can do it right in a petri dish. Expose human beta cells to fat, they suck it up, and then start dying off. A chronic increase in blood fat levels is harmful, as shown by the important effects in pancreatic beta cell lipotoxicity. Fat breakdown products can interfere with the function of these cells and ultimately lead to their death.
If you aren't good with technology, you should get the information from your doctor. Many health centers organize events for diabetic patients. You should ensure that you visit these events and you will learn a lot. The other way of controlling the condition is eating right. To be on the safe side, you should take a plant-based diet. This calls for you to eat fruits, vegetables, whole grains, and vegetables. As rule of thumb, you should avoid eating saturated fat and cholesterol. There are a number of benefits that come with eating a plant-based diet. One of the benefits is that the diet is lower in fat, therefore, you will be able to control your weight. The diet is also rich in fiber, which aids in controlling the sugar levels in the body. The third benefit is that plant diet is rich in antioxidants that improve the ability of body to use insulin. In addition to eating a plant-based diet, you also need to exercise. Best exercises that you should engage in include walking, jogging, and swimming. For ideal results, you should walk for 30 to 45 minutes per day. Conclusion. This is what you need to know about diabetes. Remember that the condition can be fatal if not well handled. To be on the safe side, you should only work with a doctor with vast experience in handling diabetes cases. Click the link below to find out how to overcome this disease.